Hello. For today's Tuesday tip, I'd like to address some of the frequently asked questions about new Smile signature crowns. First of all, what is a signature crown? Over 25 years ago, New Smile marketed one of the first commercially available pre-veneered stainless steel crowns for primary incisors. It was a highly aesthetic, highly polished composite resin that was bonded onto the facial surface of an anterior stainless steel crown. When it was introduced, this crown provided one of the most aesthetic, most durable alternatives to resin-bonded strip crowns. Of course, now we have primary zirconia crowns, which are even more aesthetic and more durable. But there are still many instances where anterior pre-veneered or signature crowns might be used instead of zirconia. Two of the main reasons that I can think of for preferring a signature crown to a zirconia crown would be using them in those children with very poor oral hygiene that has led to some really edematous gingiva in which controlling hemorrhage is difficult after crown preparation. Remember, hemorrhage control during cementation of zirconia crowns is very important, but hemorrhage will not affect the appearance of a signature crown. The second very practical scenario for choosing a signature crown over a zirconia crown is that many insurance and Medicaid programs do not yet pay for zirconia crowns, but they do pay for pre-veneered crowns. Hence, when a parent is given a choice between two aesthetic crowns and one is covered by their insurance and the other is not, many parents will choose the option with less out-of-pocket expense. Now to address a few more of the frequently asked questions. First question, are there any particular instances when a signature crown might not be the best restoration choice? The one scenario that immediately comes to mind is if you're only restoring one anterior tooth. In a case like that, a resin-bonded strip crown or a zirconia crown will likely give a much better color match to the adjacent teeth than the signature crown. Another question, do the signature crowns come in different shades or different lengths? The answer is yes to both. They come in two shades, light and extra light. Now, quite honestly, the light shade is the preferred shade to use, and rarely would you find a need for the extra light. They also come in two lengths, regular and short, with the short crowns being about 1 millimeter shorter than the regular crowns. Probably the strongest need for a short crown would only be if you were placing crowns on a child 2 years of age or younger, and even then the regular length will likely work just fine. Another question is, can I autoclave tried on but not used signature crowns? The answer is yes, you can autoclave them, but be aware that multiple autoclave cycles may change the shade of the facing slightly. However, if you only autoclave it once or twice, it's doubtful that you would see any discernible difference. Personally, we've autoclaved signature crowns in our office for more than 20 years, and I have never seen a color change issue that was discernible to my eye. The final question I'll address today is about the fit of signature crowns. Since the signature crown has a stainless steel base, can we create a snap fit during try-on? The answer to this question is no. While the fit can be snug, and you can even crimp the lingual stainless steel slightly, if you force the crown onto the prep, it may create microfractures in the facing, leading to loss of part or all of the facing at some point in the future. So do not force the signature crowns onto the tooth. Now, there's a lot more I can say about signature crowns, and I will address them in a future Tuesday tip. But that's all for today. Thank you for watching, and I'll see you next week.